Hi, my name is Michelle Artis. The purpose of my presentation today is to provide a clear picture of how ethical dilemmas in end-of-life care and the nursing profession are interrelated. I will touch on advanced directives, palliative care, and an ethical framework known as the DECIDE model. Interestingly enough, research indicates the majority of patients do not have advanced directives. The physician and the nurse professional are in an ideal position to approach the subject with the patient and their family before there is a crisis situation. Nurses have an ethical and legal responsibility to ask patients about their wishes at end of life. This communication between the nurse and the patient is strongly encouraged by the American Nurses Association in conjunction with the 1991 federal law known as the Patient Self-Determination Act. In no way should the nurse professional lead a patient and their family to believe that a vast majority of patients utilize advanced directives. Likewise, the nurse should never indicate to patient or family that the absence of an advanced directive could lead to coercing the patient into conforming only to what family members want in end-of-life care. These fallacies of reasoning are examples of bandwagon and appeal to force. Palliative care focuses on holistic care of the family and the patient, particularly when life-saving interventions is no longer an option. Implications for nursing practice and end-of-life care require nurse managers to address ethical dilemmas with the team. Nurse managers are in a position to lead the team by facilitating discussion in a non-judgmental way to ensure that ethical concerns are addressed. The DECIDE model provides an ethical framework by which healthcare team members can systematically approach ethical dilemmas with concise objectives. DECIDE is an acronym for defining a problem, ethically reviewing the dilemma, considering the choices, ethical outcomes when issues are verbalized, deciding on the plan of action, and evaluating the results. Applying the DECIDE model to ethical decision-making may potentially decrease a nurse's moral distress in doing what is right for the patient in end-of-life care. The model gives nurses a voice and a practical, objective, systematic process by which to apply the ethical principles within their code of ethics. In conclusion, nurses are instrumental in educating patients in use of advanced directives. Once the patient has advanced to the palliative care stage, the nurse professional is the integral voice in helping to implement a plan of care. Nurses confer with the team to discuss prognosis, treatment options, and plans of care. The nursing profession is looked upon with great expectations by patients, families, and healthcare team members. If nurses fail their patients, they fail themselves. Being held to the highest standard in healthcare delivery should be the ultimate compliment to the nursing profession. Thank you.